Dengue remains to be a major public health problem here in the Philippines. And recent data from the Health Department show that cases in the first quarter of 2023 rose by 94%. That's compared to the same period last year. And that translates to more than 27,600 cases nationwide. Now, most of the cases were reported in the National Capital Region, followed by Central Luzon and the Davao regions. So what must really be done in order to prevent the further spread of dengue? Joining us now via Zoom is internal medicine specialist Doctor Paolo Borja. He's from the Asian Hospital. Now, good morning and thank you for joining us, Dr. Borja.
Good morning, Doc Freddy, and thank you for the invitation.
Now, dengue is a really harmful disease that prevails even in the time of COVID-19. But just as a refresher, Doc, how does one get infected with dengue?
Well, it's good that you brought up COVID-19. So dengue, just like COVID, is a virus. It's a viral infection. The difference there is the mode of transmission. Dengue can be transmitted via an insect bite or a mosquito bite, to be specific. Mosquito called Aedes aegypti. This mosquito these mosquitoes are usually more dominant in the morning. So definitely the eggs from these mosquitoes are actually laid in still waters. So that's one of the risk factors that we see whenever there is a lot of dengue transmission going around.
Okay, now what are the common signs and symptoms for dengue fever and severe dengue? How can someone tell if the fever that they have isn't from trangkaso or the flu at dengue na pala ito?
Well, again, just like with any other viral infection, it is very difficult to tell just from the fever alone. But one particular characteristic of a dengue fever would be, one, it's high grade. Two would be the accompanying symptoms that usually come with it. So dengue usually would be accompanied by severe headache, retroorbital pain or pain behind the eyes. Dengue is actually called bone break fever because the muscle and the joint pains that comes with it is very, very painful. You see that also in flu, but with dengue, it's very characteristic to be very painful. Also, you see rashes, or petechial rashes, or parang dot-like red rashes all over the body. So that's for your usual dengue. Again, these are self-limiting symptoms, or dengue is a self-limiting disease, meaning it will go away on its own just with supportive management. However, in cases of severe dengue, it's another case. With severe dengue, you would see severe dehydration. So with patients like this, you would see dry skin, dry mouth, dry oral mucosa, and you would also see thrombocytopenia or a drop in their platelet count, which would actually lead to bleeding. So you would see patients like this, they would have severe abdominal pain, they would have bleeding coming from the nose, coming from the ears, coming from their mouth. Some of them would be throwing up blood as well. So these are severe signs of dengue, and when those symptoms are present in your patient, you should bring these patients to the hospital for further medical care.
Okay, and now for the most important question, Doc Paolo, how can we effectively protect ourselves from dengue, especially the dengue-carrying mosquitoes?
Well, again, prevention is key, as always, just like with any other disease condition. But with dengue in particular, now knowing that this is they use a mosquito vector, this virus, mosquito repellents would be nice, would be ideal to place. Also, wearing long-sleeved shirts, not wearing shorts, or rather wearing pants instead, especially in areas wherein it has been declared that there has been a lot of dengue cases. It means that the vector or that particular mosquito there's a lot of number of the mosquitoes in that particular area. So definitely prevention would be key. Also, I mentioned about the mosquito eggs being laid in still waters. So we're definitely cleaning the surroundings of this type of environment or surroundings would be better.
Thank you once again, internal medicine specialist Dr. Paolo Borja, for joining us here on New Day.